Hi, how are you?
Hi, how are you? Carlos,
Hi, nice to meet you.
nice to meet you also. Are
Very
we
good.
the only ones here so far?
I'm sorry?
No, Mia's
Uh,
here from
okay,
BCI. Good evening, you all.
good evening.
1 second, I'm just admitting a few people. I'll be right back.
Okay,
Okay.
Thank you.
let me put them.
Hello, Miss Leopold.
Hi, how are you doing?
I'm doing well, doing well.
Hello, Carlos.
Hello, Miss Leopold. Nice to meet you.
Tim here. Hello, Mia.
Good evening, Fran.
How are you?
Good in yourself.
Mia, Mia, the king is in the house.
Oh, Mr. WB, I see him. Probably connecting to audio.
Hmm. Mr. WB, how are you? Mr. Burke? You know, we have to,
I have to unmute myself. That's a key.
you don't even know how to unmute yourself yet.
No, because I spent my whole life with people trying to mute me. So I just have an obsession about that. So I just want to say that we just had a Kings County uh advisory board meeting, and as you all know, Miss Francesca is the chair, and it was just a terrific meeting.
Thank you, Warren. Thank you.
Okay, just send it by PayPal, okay?
Oh, to send it by PayPal? Okay.
Yeah.
You're
What's up,
bribing me
man?
now. So, Miss Brown, how are you?
I'm doing well. Thank you for having me here in this meeting.
You're most welcome. You're most welcome. And Carlos, how are you doing?
Oh, hi. I'm doing very well. I'm very happy to be here and thank you for having me. I'm very grateful. So I'm
Welcome.
thrilled.
We're going to give the other persons who are coming on the next 3 minutes to come on. So I just did that at my other meeting that I was part of. So I just have three of you because he's going to take part again. And as the others come in, and then we have Moto Z, Z4 coming in, and I'm going to allow the Moto Z4 to log on. So in our lives, our day-to-day. Hi, Rosemary, how are you, my dear? She's still muted. Can you hear me, Rosemary? Miss Ephraim, can you hear me? I can hear you. Hello? I don't know. I can't hear her. So what I was saying is that in our everyday today, there is just so much happening around us. So much. And you have to be grateful every day when you leave your house and you get back home. If you're driving on the road, you get back home safely, you take the train. Some crazy person did not use you as a target. You know, I mean, it's just like so much happening around us, and we have to be thankful. So, but many a times what we do, we dwell on the negativity that's happening around us, and we tend to overlook the positive that's around. And we have so much good happening around us. A lot of bad, but we have so much good happening around us. So what I would like to icebreaker that I would like. Hi, Melissa. Good evening, my dear one.
Hi, good evening.
Good evening. So our icebreaker before we start, I would just like each person on the line to give me one happy thing, one good thing that happened to you today or this week. Share just one good thing. It don't have to be a long thing, but just one good thing. Leave out the negativity, leave out the bad things, just concentrate on one good thing that happened.
Hi, this is Warren. And my one good thing is that this is the second meeting I've attended with Francesca in the last 3 hours.
This is what, Warren?
This is the second meeting I've attended with Francesca being the chair in the last 3 hours. Who could ask for more?
Thank thank you, Warren. Thank you.
You're welcome.
Anybody else would like to go? One good thing you want to share that happened. It could be this week, it could be today. One good thing that you would like to share.
Okay, one good thing. So I am slowly going back to work in person, and I didn't have any actual work clothes, you know, because pandemic life. I found the perfect pair of work pants, so that made me happy. That was it. It was that simple.
All right, wonderful.
Well, I woke up today. Many people did not wake up.
Mhm.
I'm healthy, I'm strong, I'm able to bless someone else's life. And so I'm always happy about that.
All right. Good to hear that. Yeah. Anything else that come your way is added mercy. Go ahead, Mr. Carlos.
Hi, well, one thing that happened to me, my parents live not far away from where I live. And my mother came to bring me like food. I work all day long and she brought me food to eat. So that made me very happy and we could.
And that's a
and
blessing.
we
That
had
is
a-
such,
we had a nice talk and it was a good thing.
yeah, that's a great blessing. Wonderful, wonderful. I know Mia and Miss Everin. Go ahead, Mia.
I have one. Well, you know what? I ordered my coffee this morning on the app, and it was actually the exact way that I liked it when I picked it up.
Okay.
It wasn't sugar milk. It was real coffee with just a drop of sugar.
Wow.
How I like my coffee, nice and dark. So that was a great way to start my day.
Good, good. Miss Everin, you are muted.
Okay, thank you. I was able to see my 11-year-old niece stood up and gave a speech in tribute to her grandmother, and I was so proud of her.
Wonderful. That's great. Wonderful. Well, as for me, I'm like Miss Brown. Every day that I see is a blessing that I jump out of my bed. So when I jumped out of my bed this morning, I was in sound mind. I was able to sing. I was able to walk. I was able to hear the birds, and anything else that came my way was added blessings for me, going to work and came back safe. So that was my good. So I try that when the bad that I see around me, I try to think of the good that allow it to override the bad and just concentrate and stay positive. Because if we don't stay positive and we allow all the things that's happening around us, then it depresses us, you know? So sometimes when the bad is happening, just close your eyes and concentrate on the good. Okay, so we will start, and thanks for coming. It's now 10 past. I welcome each and every one of you. Welcome Ms. Brown, I welcome Carlos, and I know Carlos, your partner should be have another meeting. So hopefully, you know, by the time we get to you, it's a she, right? Okay, she should join us. My name is Francisca Leopold. For those of you, especially Carlos who doesn't know me, my name is Francisca Leopold. I'm a member of Community Board 9. I'm the second vice chair on the board and also the chair for health and social services. And I'm passionate about my community. I'm passionate about the seniors. I'm passionate about our youth. I'm passionate about people in general. I love my community and I love to see that things are happening in my community. My community is progressing, and I love to see the quality of life in my community move from 0 up to 10. So that is my aim. And I know that with the persons that we have on the community board, the vision, the new vision and the positiveness that's now on the community board, that we may not get to do it at 100%, but I know that we will get at 90%. So, Ms. Brown, can you introduce yourself?
Hello, everyone. Good evening. My name is Miss Brown, and I am a nutrition coach and a chef. I have a program where I offer to children, adults, both with and without special needs. I teach them how to do cooking. My classes are very educational, hands-on. It's called Faith Taste Eat Kids. Faith Taste Eat Kids was born because I've noticed the rise of obesity in our communities. And because we do not know how to eat, both children and parents, adults alike, our children are not eating, as well as adults not eating and living a healthy life as they should live. My classes are very hands-on. I promote healthy eating. They're very direct. Teach self-direction, give children aid children in being more independent. Bring families closer and tighter together. And I know that these programs would be great for the community, because our children and our parents, it's not that we don't want to eat healthy, it's just that we don't know how to. And once we're educating families on how to eat healthier, a lot of long chronic diseases can end, obesity can minimize, and not only use food as a way of eating, but to use it as a source and a tool of education, because food is education. We have math involved, we have reading involved, and a lot of times due to the rush of life, we don't really get to sit down with our families and eat. So
I just want to stop you there, because you've given us a lot of information, and I know you'll do a short presentation, so you'll give us more about what you're doing.
Yes.
Okay, so I'm gonna go to so I just need your introduction and what agency you're and where you're from, and Carlos.
Hi, everybody. I'm very grateful to be here. Again, my name is Carlos Padron. I'm a psychotherapist, more specifically a psychoanalyst. I've been a neighbor of Brooklyn for 17 years, but I'm originally from Venezuela. I live in the Flatbush area, like for most of my stay here in the United States. And I, together with Dr. Tracy Seitzinger, who's a psychologist, we plan to create the New York Center for Community Psychoanalysis, which would be a community mental health clinic in the area to serve the community and the population and the many mental health needs. So that's where we're going to present tonight. Thank you for having me.
Thank you very much. And Ms. Rosemary? I don't know if you're speaking, but you are muted.
Yes, as I said, a member of Community Board 9, also a member of this committee. I am formerly a firebrand member of 1199 SEIU, a delegate also, a former student council member. Now I am on retirement, disability and everything, but I'm also an active member of 265 Hawthorne Street Community, Home Owners Association. And as the chairperson said, I am also very, very concerned about my community. I love it. I love to walk and see certain places reopening, people coming and going, and all of that. And my community is important to me, and I'll do my best as health and everything allows me to.
Thank you. Thank you so much. Melissa?
Hi, good evening, all. My name is Melissa Severe. I'm a member of Community Board 9 and a member of the Health and Social Services Committee. In my day-to-day, I work at the New York City Health and Hospitals Corporation, doing collaborative care, also in mental health. So, Carlos, I'm looking at you. Nice to meet everyone.
Thank you. Mia?
Good evening, everyone. My name is Mia Hilton. I am the Assistant District Manager for CB9. I've been with CB9 since 2017 and a resident of the community for over 20 years.
Thank you, Mia. Mia is the person who keeps us straight and making sure that everything is running smoothly with all the committees. Without her, I don't know what we would do. I'm gonna call on Mr. Burke.
Hi, everybody. I'm Warren Burke. Besides working for Francesca in terms of meeting her objectives, I'm the first vice chair of Community Board 9. And I am, in my volunteer work, the chair of the Health and Hospitals Advisory Board Council. And I'm a member of the Department of Mental Health subcommittee. And I'm on CB9, I'm the first vice chair. And I just enjoy doing stuff for the community. Thank you.
Thank you, Mr. Burke. Ms. Smith? Karen Smith, can you introduce yourself, please?
Hey, I'm sorry, I kept hitting the wrong button. Hi, everybody. My name is Karen Smith. I'm so excited to be here. I am the outreach director for Oak Street Health. So we are right in the community on Nordstrom, right off of between Parkside and Winthorpe. Really excited to be here. We do a lot of stuff for seniors in the community, and we partner with a lot of different organizations and nonprofits. So just really excited to see what more I can do to help serve everyone that's in the community.
All right. So having these three ladies, I'm not talking about our CB9 persons, but Ms. Brown, Carlos, and Ms. Smith, and what you all will be, especially Ms. Smith and Ms. Carlos, what you all will be presenting tonight. I'm looking forward to, and also I'll hear more of the Smith platform. And I want us to be at a place where we do less talking and put stuff into place. Because most times I find we come and then we talk and we sit, especially with COVID, we have been confined to our homes and we have meetings and we're just talking. And I think now we have another opportunity where we can go out there and then we could start implementing some of the things that we have been talking about. I know Ms. Brown, she was present at our wellness fair. We had a wellness fair on October 2nd, which was held on Lefferts Avenue between Bedford and Washington. And we had about 15 participants, vendors participating. And I was well pleased with the turnout and persons on that block. I'm not certain if they live on the block, but they asked me if it would be an annual thing, and they were very happy with the fresh vegetables. And we had Miss Love, Jackie Love, who was instrumental in us getting food to give away, chicken and turkeys and stuff for the residents. And we had Miss Karen give for Karen, what's her last name again? Crawford, Miss Karen Crawford from the DA's office, and she was very instrumental in also getting those fresh vegetables that we were able to give our community. And then Mr. Burke worked with us and with H&H to get the vaccine van. And we know a lot of persons, even when I was giving out the flyers for the wellness fair, and we said that we will have a vaccine van on hand, on site. And one person said, oh, you too? You're doing this too? And I said, what are you talking about? And they said, you're killing people as well? So I was like, killing people? And they said, you bring in a vaccine van on site, you know, to give people vaccine to kill them? You know, so I mean, it didn't make me feel too good. But then at the time when so from the time the van was set up, you know, the people were just going up, and people were just coming to be vaccinated. You know, and I cannot hold it against anyone who has a reservation. Everybody has their own, you know, feeling. Everybody has their own thinking. You can't be against persons who don't want to take it, and you can't be against person who wants to take it. It's persons, everybody has a choice. You know, so I'm very particular as to what's happening. We had a lot of our seniors, they were home. Some seniors were not able to go to a recreational center. Some seniors were not able to get the food that they wanted from the supermarkets, the medication, you know. So I'm really concerned about that, and I'm so happy to hear Ms. Smith talking about working with the seniors. And the seniors, they are not getting the full services that's needed, because some of them, they don't know. The services are there for them, but you just don't know how to tap into the service. And sometimes their families don't really put themselves out there. I don't know much of what Mr. Carlos have to talk about. It's something very interesting, but I don't know much about it. So I'm eager to hear more of what you have to say. So tonight we have Faith Tasty Eats Kids, and I'm hoping that I don't want to keep persons past 8 o'clock. I'm hoping that with 5 minutes, well, how many minutes do you want? 5 or 10 minutes? 5 minutes will do for you, or 10 minutes? Okay, so I'm gonna give each one of you 10 minutes. So Faith, you go first, and then afterwards, I'm hoping that Carlos, Miss Faith is not the one who's Miss Smith is not the one who you're waiting for, right? Okay, so hopefully by the time Ms. Brown is complete her presentation, then your partner would be here. So go ahead, Miss Brown.
Hello again, everyone.
Hold on a minute. Hold on a minute. I just want to put it out there that usually if you want to do a presentation to the full board, it usually comes to the committee first. We'll listen to you, and then afterwards we'll take it to exec. We'll see if it's something that we want to push forward. Okay, so it will be taken to the executive committee, voted on, to put on the bigger agenda so that you could present to the general membership.
Yes.
Okay.
Yes.
Go ahead. Go ahead.
Hello again, everyone. As you know, I do bring cooking edge education to children of all ages and parents in our communities. It's called Faith Tasty Eat Kids. It was born because I know the lack of education on food. Our children are not having the proper diets, and our community are not providing the right food and the sources they need to eat and live a healthier life. So my mission is to educate for all families on better ways of eating and better ways of preparing meals. So that's one goal that we have. Another goal is to possibly end obesity. It might take a while, but it's one step at a time, one day at a time, while educating them and just using cooking and food as a source of building tighter communities, learning, putting forth steps to getting better families and so forth. I would like to share some, if possible, can we share the screen so I can show a little bit of my work in the 10 minutes? Let me see, desktop applications. Okay, I'm gonna share my screen with you guys. I'm trying to see. Okay, are you guys seeing? Can you guys see?
Yeah. Mhm.
Okay, so this is the school that I'm currently working with. I bring education when I work with younger ages, older ages. This is how the setup look with my classes. I work with families, basically just showing them how to make healthier foods. For example, everyone loves pizza. This is a cauliflower pizza that we made that day. Of all ages, the children love it. It's
You're muted, Ms. Brown, you're muted. We can't hear you.
met them that day. This is more work of my school. I'm going to stop there and I'm going to come back into the session. So that's our Faith Takes Eat Kids mission, to bring families closer, to educate them on better ways of eating so that we can minimize and possibly end obesity. Thank you.
So I think when you first spoke to me at the wellness fair, and I think that we spoke briefly. I think we each other briefly, and it is something that I spoke to the CB9 manager, the DM, about, because I think that is something that is very, very welcome in the community. We need it in the community. But I'm telling you, I was on the bus a day and I saw like a child who was 11 years old, and you could tell that she was obese. And then she had a plate of, she had French fries and fried pork eaten, and she was already obese. And I'm like, why in the world? And her face was just like out there, and she was just, and this is something, this is going to destroy this child's life as the child continue growing up. And I think it is something, I was telling him that this is something that we should think of tapping into the school on New York Avenue. Start with our schools. I don't know which of the schools that you have been working with, but the first school that came to mind was the school on New York and Empire. You know, and I know that he have some sort of connection in there. And I think that when this is presented and it goes through the board and it's presented, we have to sit and talk a little bit more so that we can bring this program into the schools, especially the schools.
Absolutely.
I think it's a great idea.
Thank you.
Yeah, I think I thought Warren had his hand up. Okay, anyone have any questions for Ms. Brown? Go ahead, Rosemary.
Yes, mine is not really a question, but just an observation. We can talk about obesity and kids and all of that, but we have to also talk, I think you mentioned a little of it, availability of certain foods, storage of certain foods, because we know, for one, vegetable is something that takes a little more, you know, to keep. You know, your family work, well, now they're not outdoor as much as they used to. So we have to know about storage, availability, and all of that. So I understand where you're coming from. And I think, you know, for instance, I know a family of mine, very close family friend. They'll do all the nice things and prepare the certain meals, have family sit down. And as soon as they step out the house, they get what they want to eat. So I know it's a lot, and I appreciate what you're doing, and I love that. Maybe getting kids involved, showing them how to prepare certain meals and show them the reason for doing certain meals. I don't know if we have areas in our community that we can do little vegetable gardens. We could do, you know, eat what you grow, so to speak. So I love that, but also we could expand on that also.
So
Yes.
Rosemary, I so like what you talk about the garden, because it is something I know in Manhattan they do that a lot, and they do it on the roof, you know, and even the school we have, they have the fencing, and they can use an area in the summer and teach the children how to grow their own vegetables and stuff. And I think there's so much that could be done with that. And you are very right, because the parents at home will try to give the kids what some parents don't, but some do. We can blame all the parents. And when the kids go out there, they eat what they want. you know? So I really like what you said when it comes to the gardening. It's a good, we don't have this stuff, but there is space at the back of the school, especially this school, where we can take a corner and use some boxes and some tires and
Okay.
stuff, and teach
Yeah.
show the kids how to plant and cook from what they just plant. Melissa, you had your hand up.
Yeah, just a comment. Well, number one, I wanted to know specifically what your catchment area is for this initiative. And then the second thing, actually last week, I read an article about how community gardens, weirdly enough, were part of the anti-violence movement in certain states. I think specific in certain cities, I think specifically in Chicago. So I was thinking that, you know, if doing the community garden is something that we are really serious about, maybe partnering with health and hospitals and looking at it as a public health initiative to not just tackle obesity, but to also tackle gun violence, because these conversations are already happening within, you know, the department that I work. I think it's just making connections to the people that are like in the front lines to make it happen. So I like, you know, the conversation that's happening around that.
Any comments, Ms. Brown?
What was the question? I'm sorry. Can you?
I had asked, what was your, I think I missed it. Like, what was your specific like catchment area that you were targeting with your initiative?
My catchment area that I'm targeting is families. Yes, it's giving. When you're used to eating something constantly, it's not an overnight change, but just educating the families with the children on better ways to eat. Because you can still do a gardening, but if you're not practicing eating and learning how to turn eggplant into an eggplant parmesan or turn pizza into a cauliflower pizza, it's still going to have the same result. So I'm targeting children and families that are not used to, or don't have the education as far as knowing how to eat better and helping them learn how to. If that answers
The areas in Brooklyn, what are the areas, the geographic area in Brooklyn have you worked with? I noticed that you showed schools. Which one of the schools that you have worked with?
So I have worked with schools in Park Slope. I have worked with schools in Canarsie. I'm currently in Canarsie again. Park Slope and Canarsie and Manhattan.
Okay. Thank you.
You're
Go
welcome.
ahead,
Hey,
go ahead, Warren.
Hi, it's Warren. I just want to point, and I apologize, I'm not on the screen, but I'm eating dinner. But besides that, I want to point out two things. Number one, CB9 has arranged with Fresh New York City to have a farm stand on Nordstrom and Empire starting tomorrow. This will be through November when the season ends, and next year we'll expand it. The important thing to disseminate is that if you're on benefits, that if you buy a certain amount of food up to $10, you get another $10 in coupons. And that will be tomorrow from 10 o'clock to 3 o'clock. And in addition to that, we'll be having a Health and Hospitals van there for testing, tracing, and vaccinations. The second point I want to make is that there are two community gardens, since that was a question. One is at the Wingate High School. I think it's Winthrop and Kingston. And it's really a vivacious garden when you see it. The second community garden is Maple Street Community Garden. Thank you.
Okay, thank you. So I'm gonna come to you soon. Carlos, I just want to ask Ms. Brown, with your initiative and what you are doing, is there a price attached to your service?
Yes, so my service is $150 an hour. It does provide the materials and the ingredients when I'm working with children.
Okay, so with the $150 an hour, with the ingredients, how many kids are you looking to work with at any given hour?
So I work with 10 to 50, the ratio is 10 to 15 children per session.
So how many, 10 to 15 children per session? So
Yes.
the session is an hour?
The sessions would be 45 to an hour long, yes.
Okay, 10 to 50, okay, all right, thank you much.
You're
Any
welcome.
questions, anyone have anything else, any questions, any comment? For Ms. Smith on her presentation? Okay, go ahead, Karima.
Okay, my thing is more of a comment not than a question. I think what you're doing is wonderful, especially with kids and incorporating healthy eating for them because they are the next generation growing up and already a lot of them are obese or overweight long before they even reach adulthood. And I don't know which neighborhoods you are working with per se, but I grew up in Crown Heights, and on my block where I used to live on Utica and Carroll, that there's like every quarter block there's like a bodega there. And I remember growing up that my mother, not to say I didn't eat junk food as a kid, I did, but she very made sure that I eat a lot of healthy food on the weekends when she would cook everything from scratch. She's a Caribbean mom. Um, so I think that is a very good thing that you're doing. The other thing I also wanted to bring up was that I think we should also try to reach out to other like urban farms and stuff in the area or nearby. I see that there's a lot of places now in the boroughs that they're doing like urban farms growing produce and stuff from scratch and selling them like at the youth farmers markets and stuff. Um yes, and I also discovered a National Farmers Market Directory which lists all of the existing farmers markets in New York City. That was completely by accident, but I was doing this for my internship and I happened to stumble across a good number of them and I only could have found like two in the Crown Heights area.
Thank you very much. I know that I see your hand up. I'm looking at the time, Ms. Brown, so I'm gonna give you a minute to make your comment and I'm gonna go over to Carlos.
I just wanted to add to what Karima said. I'm very familiar with that area. I am on Union and Utica, and I agree that that side of Brooklyn, if it's not a Chinese store, it's a bodega or a liquor store. So that our community is starving for the need and the education of eating healthy because they're not providing these tools and these sources for our children to live a healthier life because they are the next generation. So I just wanted to add that in as well.
Thank you so much. Thank you. Carlos, the floor is yours.
Hi, everybody. Thanks for having me. A brief introduction. I'm Carlos Padron. I'm a psychotherapist. I've been in New York 17 years, working mostly in different community mental health centers all around the city. And I also teach, I'm a professor at the School of Social Work in the Silberman School of Social Work in Hunter College. So I'm very committed to bringing mental health treatment to the communities and building centers from the communities up and learning from what the communities can offer in terms of their own ways of dealing with mental health issues and learning from the wisdoms of the community. That's a little bit about me. I'm the co-director of the New York Center for Community Psychoanalysis, together with Dr. Tracy Seitzinger, who's a psychologist, also with many years of experience in the area, who's not here. She went to a meetup with with Eric Adams, so we have to separate many times we need as much help as we can from different people. So I prepared also a slideshow to make things as succinct and as precise as possible because I know that I only have 10 minutes. So I'm going to share my screen as well. Desktop share. Give me 1 second. For some reason, it's not allowing me to share the screen. Could be my computer. Let me see.
Yeah, I've made you co-host, so you should have the capability.
Open system, security, privacy. Give me a second. I apologize. I didn't know that my computer had to. If not, I can just talk about it. If it's through. Okay. Well, I guess I'll just speak about it. I don't want to take more time. So the first part of the presentation, again, the name is New York Center for Community Psychoanalysis. A little bit of the overview of what I mean for to make it easier. It's the NYCCP, New York City for Community Psychoanalysis. It's recognized. It started by recognizing. I mean, it's still a project. I'm going to tell you how far into the project we're in and what type of help we would need from you. First, we started by recognizing the need for mental health, a mental health clinic in the Flatbush area during the twin pandemics of COVID-19 and racism. That was the first thing that would motivated the idea of creating a mental health clinic, and specifically in the area, and also because we're me and my co-director are neighbors in the area. We're already registered as a non-for-profit since March 2021. Okay, so it's a non-for-profit clinic. That's an important thing. We're already registered as that. We held our first town hall meeting with people of the community in 2021 to recognize and hear from the people different mental health needs. We discovered many things: homelessness, substance abuse, domestic violence, more severe kind of mental disturbances. So we all recognize a great need for a mental health center in the area. So we held that first town hall meeting in 2001. We've also been slowly engaging with the community and with community organizations, such as, for example, Flatbush Tape. You might know them, with Ola Yinka and Q, who organize self-care days on once a month in the Prospect Care Park, where we participate, and we've offered what we call listening clinics, which is like offering listening spaces to people to talk about their issues. So this is what we've done so far before that's towards the creation of the clinic. And we're seeking ultimately to open the physical center in early 2022. Okay, that's an important thing. Let me continue with the other slide. I'm going to give you a little bit of an overview of mental health needs in, let's say, United States, New York, Brooklyn, and then particularly in CD9. That makes our clinic necessary, we believe. 57% of adults in the US and 60% in New York with a mental health illness did not receive treatment in 2020. Imagine 60% in New York. 21% of New Yorkers have inadequate access to treatment, to mental health treatment, including lack of what's called intensive community services, which have proven to be much better in the treatment of mental issues. Also, New York City the city itself acknowledges a historic disparity in healthcare access and refusing to provide funding to communities of color. This is from 2018 from the new nyc.gov website itself. Just 1 second before I continue. Okay, so there are issues obviously around mental health in the area, right? So some areas that would be served by our clinic currently have higher need and fewer resources than other communities in New York City. Some of these neighborhoods or communities are Lefferts Garden, South Crown Heights, Prospect Heights, Bed-Stuy, Brownsville, and East Flatbush. These are all identified by the 2020 CDC report identifying New York City neighborhoods at risk of being overlooked for intervention as having high levels of disparity on health outcome measures relative to other communities and districts within the borough. So, and these are all areas that are going to be served by the clinic. Currently, CD9 has only 6 health and human services agencies offering outpatient mental health services for adults, only 6. CD9 had 1,102 psychiatric hospitalizations per 100,000 people, compared to 684 per 800,000 in Brooklyn, meaning it's, let me put it easier, CD9 had 1,100 psychiatric hospitalization versus 684 in comparison to the rest of Brooklyn. So it's higher, the psychiatric hospitalization, and one of the reasons of the clinic is to prevent hospitalizations as much as possible. And the last part in terms of offering mental health need in CD9 is that research has found that community-based treatments reduces both violent and financially motivated crime in the areas where they are. There's a whole research around this. So what are the types of services and resources provided by the center that we're proposing?
You have 4 more minutes.
4 more minutes, okay. We have 7 therapists, including social workers and a psychiatrist on staff. We are going to employ, we're already talking brown and Black people therapists within the community and that offer cultural responsive services. And what we're gonna do, we're gonna offer 9,000 treatment hours a year, individual, couples, group, and family therapy. We're gonna have an intensive outpatient program, and it's gonna serve as a community center where we might partner with other community members and organizations for skill sharing and outreach, and ultimately it also is going to have free childcare on site. And to end, if I can have a couple of minutes, it's going to be accessible. To begin with, it's adults. We're in the future, it's going to treat children as well, but we're going to start with adults. It's going to be accessible treatment for all, regardless of income. Medicare, 40% of the people we see, Medicaid, Medicaid, 40%, Medicare, 5%. And then the remaining 50% is going to be self-pay based on income, okay? And there's going to be a 5% of low fee or no fee at all. End-to-end, the catchment areas, there was a question that was asked, are Lefferts Gardens, South Crown Heights, Prospect Heights, Bedford-Stuy, Brownsville, and East Flatbush. What we need from CB9, we need a letter of support in order to be able to receive the license to be a functioning mental health clinic in New York, approved by the state. We already have several letters. We may talk about it, but your letter will be particularly valuable. We need your connection to other relevant organizations for the project that we're putting forth. And we need help securing city and state funding for the social services that we're going to provide. Thank you very much for having me.
Wonderful. Great information. I know we are heading out of time. I don't want to spend too much time because I want to give Ms. Smith 2 minutes to tell me about her organization. But Warren have his hand up. Go ahead, Warren.
Hi, it's Warren Burke. I have a lot of questions about your program.
Yes.
Both Francesca and I are on the advisory board of Kings County Hospital, and I am also on the HCH advisory board. So my question is this: we all know that our district, Central Brooklyn, uses the most benefits possible, okay, and the most services possible. So Francesca and I just got off a call with Kings County Hospital. So, you know, that's an award-winning behavioral health institution. In fact, it is just amazing the kudos they get. So what do you think about what's going on with the teenagers of our district?
What is what? Sorry, I didn't get that. I'm
What's
sorry.
going on with the teenagers of our district?
The cheatings, the what?
Teenagers,
Oh, the
Yes.
teenagers, what's happening?
yeah, mentally. What are the demands? What are the services?
Okay. There is, in Kings County Hospital, I don't want to take my time, they don't,
No, no, this is my time, so don't worry.
okay, I'm worried about the time.
Go ahead.
During the town hall meeting, something that we saw is a disparate, I mean, traditionally, and I know this when I'm from Venezuela, which is also, part of the North, which is part Caribbean, so I'm aware of that. There's a lot, especially in like older generations, traditionally, there's been a very much of a like a distrust of therapy, of going to therapy. And that's something that we've talked to and we've identified. But the younger generations are more inclined to want to go to let's say to see a therapist, right? And many of them in our areas feel a lot of shame or a lot of conflict around going to these services, not only because, I mean, a lot of mental health issues are stigmatized, but are particularly stigmatized within our communities, and Caribbean communities. So many of them just don't go to it.
So my question
So
is,
that's one thing. That's one
thank
element.
you. So why are you starting off with adults?
What are we starting with?
Adults. In other words, you mentioned nothing about the younger people.
No, we're including within adults, we're including 15 years and up. I was speaking too fast for the sake of time. So it's going to
Okay.
be teenagers and adults, but not children,
Okay.
yet, which is children would be under, let's say, 14 years old. Because for now, we need to start small. Working with children needs many more services that we'll provide in the future, but definitely teens and adults is going to be our focus. During the town hall meeting,
What was the town hall meeting?
We had that,
And what was it through? Who was the attendance who sponsored it?
it was on Zoom because it was during COVID. And
Correct.
we had around like 60 people from, I mean, we put out, we send out the information to people to come. I mean, it was free. So it was around that number of people that were members of the community from different organizations. And the one person, that's the number, and one person that I forgot her name, was a social worker who works at the SUNY State Hospital right in front of King's Hospital. And I wasn't aware that there's a small office there that provides therapy for LGBT people within our communities. And when there was the conversation of how like many Haitian people traditionally don't go to therapy, she said she didn't understand. She said she had a waiting list of like around 200 people, mostly teens, waiting to go to therapy, right?
Right, but excuse me, but you didn't mention that. You're centering on adults. The second thing is, who were the people who gave you letters of recommendation?
Okay, so far
What are the organizations?
We need letters of recommendations from, well, people.
No, not that you need, that you have.
Okay, we have
As you stated.
We have letters of recommendation from in the specific area from the people from the Flatbush mixtape. We have a letter of recommendation from I can't remember the doctor now, a doctor from Kings County Hospital. We have a letter of recommendation from Kirkland Vongs, who's a very well-known Black psychotherapist. We're working in communities of color in New York City, especially
Do you have any recommendations from any stakeholders in Crown Heights?
No. So that's why we're coming also to you to, again, we're launching the project. It's gonna open in 2022. It takes time. So we wanted to pass and present it to you first to get your your input, your acceptance, and your help. That's why we're
Good.
here.
Okay, thank you so much. I appreciate it.
Yeah.
Thank you so much for answering the questions. And I'm gonna give where is Melissa? Melissa, and then I want to hear from Ms. Smith quickly. Go ahead, Melissa.
Yes, very quickly, because we're approaching eight o'clock. I just was interested to know, like, now that we've been in a pandemic and we've experienced using telehealth and video services, like, how do you
I lost that.
Yeah, we lost the last part of the question.
are like amazing. But anyway, I'm just curious to know how you plan to incorporate that.
I'm sorry, we lost you when you were asking the question. I'm sorry.
Oh, no, I'm so sorry. Can you hear me now?
Yes.
Yeah.
Okay, cool. I was just asking, how do you plan to incorporate telehealth and video health into your business model? Like, or is that like going to be an integral part of the services that you provide?
Well, yeah, I think the future of mental health in general is going to be a mixed model with people in person and people that don't want to come in person, because not only because of COVID, but also because it might be more convenient. For example, the elderly, it has been offered the possibility of the elderly to go to therapy. So we're definitely going to incorporate that, but we do really want to have ideally a high in-person presence, because it's also been, researched that in-person therapy, especially with people with more severe mental disorders, makes a big difference.
Absolutely, yes.
So, but we will incorporate the other option as, in case people can't, of course, because I mean, that's how it's going to be in the future. I have no doubt. It's here to stay.
Thank you.
Okay, thank you so much. Thank you so much, Carlos. Ms. Smith, would you like to give us like 2 minutes of your, just give us a little bit on your organization, please? And then you can leave with us your contact information. Ms. Smith, are you still with us? Okay, it doesn't seem that she is there. I needed to, I guess, Melissa, because of time, I wanted us to have a short meeting. I don't know if Mia have to Mia and Warren, if you can, after we dismiss, if you can just stay with me for like 3 minutes, I would be grateful for that. I know that it's already minutes to eight.
Yeah,
So, but I thank each and every one of you. I'm asking
Excuse
before we
me,
close.
Francesca.
Yeah.
Hi, it's Warren. Do we have a quorum?
No.
Okay, because before that gentleman who just spoke could be presented to the board for a letter of support,
I think we have to take it to, take it to the executive first.
No, first your committee has to approve it.
We don't have a quorum, but it's just Rosemary. Okay,
Correct.
so 1, 2, 3.
And how many people are on the committee? Voting members?
Well, Francisca can proceed the same way Yakov did. Yakov did not have quorum at public safety. So as the chair, he presented the issue at hand to executive to let them use their discretion on whether to move the matter forward to the general board.
Okay, perfect. Thank you.
Thank you very much. Thank you for clarifying that, Mia. Okay. So before we go, I know Ms. Brown, you had your hand up.
Yes, I wanted to know if we're able to send out everyone in exchange email information as far as contact information, since we all in the community.
Okay, so we don't have a chat, so I don't know how Mia, how possible that we can do that.
I have everyone's information. So how do you want to just share it with the membership or the community, or Ms. Brown?
I was just checking if everyone can have like a chain where everyone has everyone information. But if you have it, then
You know what? I can
Mhm.
actually just create a follow-up email with the original invite and just make sure that everyone's on that loop. Just thanking everyone for coming out to the meeting and making sure that you guys are all on that correspondence.
thank you.
No
Okay.
problem.
You're welcome. So Carlos, you will be hearing from us. We have your email address, and Ms. Brown also, we will be touching base with you. And I'm assuming that Ms. Smith, she's still not back. She's not with us. I know earlier on she was trying to unmute herself, but she was having issues. So I'm not sure if she's trying to do the same thing.
She's
But
still
nevertheless,
muted.
yeah, she's muted. Yeah. But so Warren, Melissa, and Mia, please stay back after we dismiss. I want to thank each and every one of you. Great presentation. I'm impressed. I'm looking forward to see, where everything goes. I'm looking forward to working with you guys. Thank you for taking the time off to being here with us. And we'll be talking again. We'll be touching base again.
Thank you. Thank you for having me.
Ms. Smith, you're back. Ms. Smith, you're with us now?
So we remove
Yeah,
ourselves.
yeah,
right now.
I've been here. I can't take my thing off mute and you guys don't have a chat and I didn't want to log out and not be able to get back in.
Okay.
So the only way I was able to click off mute was when you sent it.
Okay.
Oh my goodness.
So yeah, so we wanted to hear a little bit about but it's Mia, can she give a little something 1 minute on her organization? It's okay with you?
Sure.
Okay, go ahead, Miss Smith. We just need to hear about your organization. You stayed with us, so we want to give you the opportunity so we can hear about your organization.
Yeah, absolutely. You guys can hear me, right?
Yes, we can.
Okay, so yeah, so Oak Street Health, I know we're new to New York, but we're not new to seniors. We're primary care and we focus on Medicare eligibles in high need areas. So most of our seniors are coming from areas that are lacking primary care, where they have like a lot of urgent cares and things like that, and they don't have a provider that's able to help manage their health. So that's what we do. We work very, very closely with all the hospitals in the area, and we're responsible for just taking care of the patients. We provide things like transportation. We coordinate all of their care for them if they need any additional resources, even mental health services and things like that. That's what we provide for our patients. We're super excited. We're now partnered with AARP as the only primary care carrier. So all of our patients get complimentary AARP memberships. And like I said, we do a lot of things in the community. So I'm excited for you guys to know more about Oak Street. You'll see over 30 locations between the boroughs by like this time next year.
Okay, do we have your contact information?
I believe you do. That's how I got the Zoom invite. I can.
So I'm assuming Mia has it, so I'll be able to get it from her.
Yes, yes.
Okay, no problem at all. Yeah, so thank you so much, and thank you for staying on with us. And and then again, I just want to say thank you to each and every one of you for being here for your presentation. I'm excited. I'm looking forward for us to collaborate and work together for the better needs of our community, and then to serve it, especially our seniors. Carlos, I want to hear more of what you're offering in the community, because sometimes we tend to think that someone have to be going crazy or walking the streets, talking to themselves, before they could sit down and talk to somebody and sit, because sometimes there are some little stuff people playing at the back of our minds and we are not even aware of it. So things happen in our lives. We lose loved ones. Things happen in our lives and we don't even understand how it triggers the way we think and the way we think. So it's not necessarily somebody who's walking on the street and they go off the deep end, they're talking to themselves, they're talking to the tree, or they're throwing rocks at the cars, and it means that's the time that they need to sit and talk to somebody. So I'm looking forward to what you're bringing to the community, and looking forward, Ms. Brown, to working with you as well. And also Ms. Smith, looking forward to working with you as well, especially with your work with the seniors. I'm really looking forward to working with you. Have a good night, everyone. And please, as I said, Rosemary, did you have any questions for any comments or anything before we go? And
Yes,
Rosemary, Rosemary, I need you to stay as well. Sorry.
Okay.
Mhm.
I just wanted to find out from Carlos if there is an outreach program, meaning, you know, people who go out and, because as you said before, which I am very appreciative of, that shame and fear
Yes.
prevent a lot of us from getting, especially us from the Caribbean
Mhm.
and black. So, you know, it's twofold. So I am very aware of that and I am thankful and I hope we can see more. And as for Oak Street, we are embracing it because family member of mine will be there tomorrow.
Oh my God, what's her name?
I'm not going to tell you his name, but
Oh, okay.
at
Yeah, we
12
have
at
over, yeah, we
12:20
have like 10 people
12:20
coming tomorrow.
p.m.
So yeah,
tomorrow.
that's
Thank you very
awesome.
much. Thank you all very much.
Thank you. Thank you. So Melissa, Rosemary, Warren, Mia. Thank you, everybody else. Have a good night. Thank you for being
Bye.
here, and you will be hearing from us.
Thanks for
Good night.
having me.
Thank
Thanks
you,
for
everyone.
having us.
Bye-bye, everybody. Great
Bye.
presentation.
Okay.
Bye. Yes, yes, it was. Yes, it was.
All right. So I don't want to keep you guys for too back for too long, but we have the budget where we're getting. We're supposed to submit our paperwork by today, but I spoke to the chair and then he has given us up to next week. So we have help. We have our committee, and our committee is somewhat kind of strange as to what we can do, what we can buy, what we can, you know, what we can purchase, because I know that there is a limit. So I just need Mia to tell us as to, I know when we had the needs going on, and then you as we worked with, so the two things I'm gonna bring up is when it come to the senior centers, we did a needs with them a few years ago. I think Mia did mention to me at the last budget that was given, I think it was fiscal year 2019 or 20, that Shalom did get some monies, but when we did call them to invite them, all the other senior centers to come in to sit with us, we didn't
No
see
one
them because no one came, because I think
no one came.
they felt that they've been coming, they've been sitting, and they're not hearing anything, because Shalom used to say, I ain't heard nothing from you guys, I ain't heard nothing, and I ain't heard nothing, and I ain't heard nothing. You know, and San Gabriel you says the same thing. So I think that now we have to look at a new way how to go forward with the budget and the information that we put there, and we have to be precise and put everything instead of a lot of many of the times they so and I know we didn't do that the last time, copy and paste, and we cannot do that. We have to let them know, okay, this is Fenimore, and Fenimore, we cannot really advocate for Fenimore because they're not registered with the city. But the other ones who are registered with the city, we can advocate for them. But we have to come with the needs and then the numbers and figures and everything that they need so they can really get. I don't want them to think that we're wasting their time. So also for the committee as well, whatever that we need to do later on in the year, it could be next year for our seniors. There is so much that we can do for our seniors, but our hands are tied because we don't have the finances, and we have to go based on whatever that they give us in the budget. So I don't know, maybe Mia can inform us as to when it comes to the committee as itself, and Warren as to how that goes and how we can go about asking for monies for our
Are we
committee.
talking about like budget for committee activities? Or are you talking about recommendations for the city budget?
Both.
Oh, well, two different animals. So budget for committee, essentially, the board could do, it's a very small list of what the board can do in terms of space rentals, chairs, tables, refreshments are limited to water. We have paper products. It's very basic. Printing, things of that nature. Unless it falls within a certain category within the city budget, in those lines, we cannot purchase it. We cannot buy hot food. We can't buy food at all. Yeah, it's very limited, and we're given a specific directive from Borough Hall that gives us a line by line listing that's existed since way before I got to the board, that tells you exactly what we can and can't do, because for the most part, the funding is supposed to be for the community board admin
Mhm.
and the running of the office. So
So
it's
what,
very,
so what is that budget like? Would it be like a $500 or $1,000?
Dante didn't set a limit. I think when he sent you guys this information before, he essentially said to come up with whatever your plan is for your event, and it'll be evaluated on a case by case basis. And essentially, he would see exactly what board funds can be attributed to it.
Okay, so because what I'm looking at, I'm looking at it because even like when we had the wellness fair,
Right.
I'm looking if we could get like help a CB9 HSS, like t-shirts. That's something that people would wear, but just the community have those t-shirts that we could wear. So when we
Right.
have in a program, they could identify that is who we are. So that's what I'm looking for that. And also if we can, I know CB9, you will
Well,
have your
I
table.
think, you know, what Dante is actually going to send you guys as committee chairs is a document where you have to fill it out and actually
Okay.
lay the vision out for the event in your ask, so
Okay.
that it's an organized process. So we can, you know, go line by line, like that's doable, that's not doable. Maybe a
Right.
community partner can do that. We pull in
Mhm.
another CBO, you know, that's something that they can do. But I believe that he'll be sending out that document within the next week or so. So it'll make it easier for you guys as chairs to lay out your vision and, you know, get a realistic evaluation about what support the board office can lend. But I think that the most pressing issue that Dante was concerned about is the budget submission, because that's due next week, which is the city budget.
Okay. So for us for this city budget, there we haven't done anything concerning when it comes for the persons because most of the time I really used to target the senior centers,
Mhm.
and I haven't had any dialogues with them at all. I
Okay.
tried. I've been calling. I have been calling. And no one picks up the phone. The last time when I tried to reach St. Gabriel, um, the gentleman answered the phone and then he gave me a number. He said you could call Judith on this number, and I called and nothing. And I left a message, nothing. And then eventually she called me back. And then when she did call me back, she said, well, you know, nothing really is happening. The center is closed. The seniors, they are their homes, you know, so there
Right.
wasn't,
But
yeah,
it's been hard. The last year has been COVID. Everything
yeah,
has been COVID, and that includes all the agencies. Their funds have been redirected.
right,
Even DOH, MH, and we're calling from the office to, when we get rat complaints, their staff is being redirected to COVID initiative. So the very basic services staff is being rotated to, you know, fill in the gaps for all of
right.
these COVID-based initiatives. So
Mhm. Yeah, and even Christopher Bledman, when I reached out to them also, I spoke to Ms. Bruce, and then she told me their head office, which I Fort Greene Council or something. So Fort Greene Council, I think they are the ones who really take care of all the expenditures and everything for, because you know that senior center is in the NYCHA building.
yeah,
I remember
that's
a
a
few years ago.
hybrid. That's weird.
Yeah, so what they really wanted, the appliances and everything. But so apparently what she said to me that the seniors, they come down and then they just give them grab and go. So they don't come and sit down. So the facility is not open so that they could say, okay, these are the needs we have now, because they don't have any seniors coming in. With Finimo, as I said, they are not registered. And I think there is a new pastor there. So I have to touch base with him to see what he's willing to do, whether he will register the center. Agent have been trying to work with them, you know, so we
Yeah.
don't know, but they are in need. And them, if they were a set of persons that we really wanted to advocate for, they are the ones, because the monies, the budget is so small, they get discretionary funding from Borough Hall, and they used to get something also from Matthew Eugene. And any given year, they used to get like $18,000 to $19,000 to run the facility for the year. So we,
Right.
but we did put them as part of the needs when we did it. We did include them,
Yeah.
so therefore we
I
don't really,
believe, I think, Sholem Center, they got a few of their asks a few years ago. I know they had a flooring issue.
right, and it's,
That was taken care of.
okay,
But,
so they
I
needed
don't know.
chairs, they wanted the steam table and the flooring.
Yeah, I guess you guys will have to connect with the directors of the centers. I think, the public hearing is Tuesday. The draft is due to DCP on Friday, so I think Dante's gonna stop taking input between Thursday and Friday just so that he can finalize the document.
Right. So
So officially
I'll
ended
see.
today, but he'll be taking input continuously. He's not gonna decline, input for, budget requests.
Right, because I spoke to him about it and I said, look, we are meeting tonight and then I'll be in discussion tonight. So he said, okay, I have up to Monday to send it to him. So I'll try to make some calls and touch base, even furthermore, I'll get some information from them as well and see if I can get you to Christopher Bledman as well as at St. Gabriel's.
Right, even if it's something as, I'm not sure if you saw the Diff My Ride, the on-demand car service from Department of Aging. 17 got it, we didn't get it. And that may be because, they are a two-fare zone kind of. It's you gotta take the bus to the junction and, the train to the junction and take the bus to whichever direction you wanna go, but, the argument can be made that we don't have a lot of accessible train stations.
No.
So that can be an argument for the Diff on demand.
Yeah.
Okay.
Yeah.
Okay.
We missed that. That's crazy. No, it's just very strange that, 17 got it and we're right next door and we didn't get it.
Right,
Just
they got the on-demand car
strange.
service.
Very, very strange.
Did we put in a request for it?
I'm not sure what we would have to speak to Sharice Lawrence to see exactly what criteria was used about which districts would receive it.
Oh, somebody just jumped on. I'm not sure who this is.
I know. Hello. Good night. Hi, Miss Gerald. You're muted.
Hi, sorry, it's not Gerald because I'm at work. That's my coworker. My name is actually Patricia Brathwaite.
Okay.
About 288 Crown Street.
Oh, so we have already finished our meeting. Yeah, you're muted though. You're still muted. We cannot hear you.
Sorry, I just muted it back. Sorry. Okay.
Yeah.
Completely.
Yeah.
Okay.
So we finished our meeting. So we're just having a committee meeting. We finish at 8 o'clock.
Okay. I'll know for next time. I thought that it was started.
Yeah, we start from 7 to 8.
Okay. Okay. Thank you.
Okay. Thank you so much. Have a good night. Okay.
Hey, this is Warren. A couple of things. Number one, just to redirect to our meeting. Are we alone, Mia?
No, oh, okay, she's gone.
Only members? Okay.
Yeah.
First of all, I think we should table any letter of recommendation. Was that his associate who just showed up?
No.
Okay, so he does not have a grasp on what's going on in our community in terms of mental health. And I would just table his his request until we have further information. Number one. Number two, about the budgets. The bottom line is that the only thing that the community board can pay for is rentals as well as water. So the last wellness fair was privately funded. So we need to start thinking about how do we raise money, okay, as a committee. And the last thing is,